I think I know.
Oh, you think
my
you know.
favorite person is in the studio.
other than Monday, of course. I'm
Yes.
just trying to state the
I know
obvious.
I know that it's the second hour, and I know that it's Monday. But it's not just any Monday; it's medical Mondays.
Yes. Do
you want to continue?
Right. It's not just a Monday. It's a Monday because it means that we get to press pause on the chaos and get a little smarter about our health. When it comes to real talk in the medical world, there's only one name that we trust to make the complicated feel better.
Yes, my favorite person is back in the house, or technically, the studio. Someone who's practically our honorary co-host here on the Midday Exchange. He's the group CEO at First Care Solutions, and probably the only person who'd let use the word clinical governance without switching off.
Hey. Welcome back, Dr. Steve Holt, friend of the show, medical mind, the full-time translator of big healthcare terms into human language. Doc, it's good to have you back.
Paul,
For the 10th time.
Thank you.
That's what it feels like.
So cool to be back. Thank you.
I see you dressed up for us today.
Yeah.
I did. I forgot it wasn't TV.
Well, we kind of have TV in studios.
We do.
Because we do record this with a YouTube channel for everybody who is not able to tune in real time. They can always go back to YouTube and watch what it is I share on the midday with you.
Yeah. Very cool.
So today we're looking at, I know the topic has to do with patient safety.
And clinical excellence.
Yes. So are we ready to jump straight into it?
Absolutely.
Okay. So, Steve, how do you define clinical excellence for the everyday patient?
Look, this is a great topic, and it's quite a difficult one because medical stuff is just so personal.
Yeah.
But I think meeting the expectations, aside from the obvious of getting the clinical diagnosis and treatment correct, it's meeting expectations. And that's one of the big challenges we have in emergency medicine, because you have such a short time with the person. You know, the person comes in, you don't have time to get to know them, you don't have time to build much rapport with them. So you end up having to dive right in, get the diagnosis. And it's one of the big challenges we have in emergency medicine is building a rapport to the point that the person can sort of really come away from that, other than saying, gee, they saved my life or whatever. It's just limited in its time, which makes it difficult.
Yeah.
Well, unless they've seen you a couple of times, then only that builds over time.
Oh, man.
If you're coming in with too many medical emergencies, it's generally another problem.
Oh, man, you again.
For the same thing. I'm only saying this because in varsity, I know with my doctor, yes, in the beginning, like you mentioned, it's a bit like, oh, okay. And then by my 10th visit, I'm like, yo, doc, you know what I need? How's your wife? You know, so, but it was for the same thing over and over and over. Maybe it was for a doctor's note, but that's a story for another day.
Yeah. It's like, oh, man, you again. What are the most overlooked risks when it comes to sort of patient safety?
Sure. I mean, this whole topic, we could probably go on all day. But for the purposes of this conversation and to keep it interesting, I think what people tell the doctor is something that is always concerns me, because especially in an emergency environment and in virtual healthcare, you have limited time to understand a problem.
Yes.
And people don't always recognize the significance of a medication that they're taking in relation to condition that they have. Yes. So I always think of things, people, they run a race or they do a cycle race or something and they fall off. The first thing they do is take anti-inflammatories when, they're already dehydrated and then they go and bump their kidneys off by literally doing something that is relatively innocuous in a normal circumstance.
Sure.
So I think it's that awareness of medication and what you're taking. Not that everything is bad, and often things are very, very important. But you have to make sure that you understand what you're putting in your mouth.
I have realized that over the last 3 or 4 years, having to learn to speak doctor talk, as it were, jargon, as it were, that you have to kind of get, and I'm sure this is purely a frustration from a doctor's perspective, that, I mean, you obviously don't show the patient that you're frustrated, but the more information you give, the more correct information that you give, the better your chances of getting well again. Like, for example, I have only recently learned, because of my shoulder, I have only recently learned that there is a difference between stiffness and pain.
Yeah. Well, look, part of that is the doctor skill and the doctor training to be able to elicit the right responses. But I think often people don't even consider things. Certain vitamins that you take in normal circumstances are absolutely fine, but in certain conditions they may not be. Medication that people take to sleep, where'd you get them from? What did you do? And a lot of traditional medicines are also incredibly dangerous.
Really?
So I think it's important that people just understand before you put something in your mouth, you need to make sure that it's safe to do so.
Yes, absolutely.
Do your research. It's so ubiquitous now.
Yeah.
You can ask so many places, and now there's virtual healthcare as well.
Yeah,
you can
you
jump
see
in there.
exactly.
Yeah, exactly. I see what you did there.
See.
I was actually about to ask, because we're talking about how people must understand what it is that they're putting into their bodies and so forth, and also what they have underlying that could not basically take the medication well, right? And we talk about people must read, they must educate, but are there any other ways in which you can safeguard to prevent medical mistakes as a patient? Because I'm sure for you doctors, you're already doing everything that you can to safeguard against those medical mistakes. But as a patient, how do I safeguard apart from picking up a booklet and reading?
Sure. I think being aware of your body and knowing yourself is really important. I always used to joke with my dad because before he passed away, he'd phone me for everything and he'd say, "Hi, just phoning to say hello, and can I take this? And what do you think of that?" Or the lady down the road said that this was, what she used for her arthritis. What do you suggest? So I think, firstly, simple things like not sharing medication, being aware of what you take, and make sure you get good advice, make sure you take it as instructed. Those kinds of things when it comes to medicine. Also, with a lot of the chronic illnesses, I think like blood pressure, diabetes, those kinds of things, HIV, you have to take your medicine regularly and forever sometimes to make sure that you get better. And compliance is a major challenge that we as healthcare professionals face, with people not understanding the significance. They think your hypertension meds is like your antibiotic. Take it for 5 days and the blood pressure
it doesn't work like that. Yes.
And then, what type of or what kind of culture helps medical teams deliver safe care? What sort of culture needs to exist?
Yeah. I think medical training trains you for a lot of these things that become almost second nature to us as doctors. That being said, you're trained to be cautious as a healthcare professional. I mean, now Hippocratic Oath says first do no harm. So I think that's the first place where it starts. It's ingrained from your training to be cautious, do no harm, and make sure you are not just, I want to say, winging it when it comes to whichever healthcare area you're in.
Yes.
From a culture perspective, you've got to have a safe culture. You've got to have people who are prepared to take the time to check, double check, write correct notes, make sure that they've checked and tested equipment, make sure that the policies and the procedures are in place. They have something that they use in the airline industry, which we use in our business, called the Swiss cheese model. And the Swiss cheese models, in order to have an event, you've got to line up all the holes in the Swiss cheese right the way through.
Yes.
And the more discs or layers you put in between that can sort of interfere or pick up an error or a mistake before it happens, the better. And as you get more experienced, you obviously have your own Swiss cheese discs that you put in between. But I think from a business perspective, we've got so many, policies, procedures, training, all of those things mitigate risk, and education. The list goes on and on and on.
Okay.
Sorry, Paul. A lot of times when we speak about danger and risks, especially for a topic like this, because everything is going to center so much around safety, just to put the listener at ease, right? And especially because there's, again, Dr. House and The Resident, where you watch these things and medical oopsies happen. And in your professional experience, just to put our listeners at ease, quickly just what do the stats look like around that sort of negligence? Because I'm sure it's not as popular as we see on TV in these series.
I think we need to clarify a few terms here. So I think the word negligence makes the hairs on my arm stand up. It's a terrifying thing, and it implies that an error was made and harm was done based on an omission or commission. Mistakes happen through no sort of bad intention of the doctor, the patient, the nurse, whoever. And complications happen. So complications are things that are within the normal realm of medical care. And I think what we've sort of seen over the years is that what initially was kind of deemed a mistake is now being looked at to say, well, should that mistake have happened based on policies, procedures, all the things that we put in place. So your accuracy is definitely improved over time. That's the first thing. But mistakes still happen. Doctors still get tired. Doctors still forget. Doctors still stub their toe, have a fight, whatever. That, you know what I mean?
But also having not disclosed something also causes the mistake.
Absolutely, yeah. There's loads of those examples as well. But that would be an omission based on malinformation. But errors then creep in. Yeah. But errors usually creep in, serious ones where there's sort of a consistent deficiency in a system. Yeah. And then you get errors creeping in. But for patients, I mean, negligence is actually very, very rare. Yeah. Okay. Mistakes happen, definitely, and complications happen. And we spend a lot of time trying to explain the difference to people. Yes. Because, quite honestly, I don't go to work ever to try and hurt someone or try and create a problem for someone. And I think where we have to get better with as doctors, particularly, is our explanation beforehand. It's not just about consent. It's about informed consent, making sure that people understand what can happen and what can't happen, and creating ultimately the excellence is meeting the expectation clinically, medically, and as a social sort of interaction.
Absolutely. We take a little music break. When we come back, that gives you time to think about this one. We chat a little bit about real-world examples of where patient safety has, in fact, saved lives. We'll do that on the other side of these. .919 FM, Medical Mondays, 29 minutes after 1. It's the guy that helps everybody. You know that dude from Astronomer actually wants to sue Coldplay.
Yes, I heard.
Right?
Did you see Sinner dropped them as a brand?
Yeah.
As
really?
a spot,
Madness.
He was like, he's not about brands that promote promiscuity. It's a story for another day, though.
Yeah. Let's talk a little bit about. Can you give us a real world example of what where patient safety has saved a life?
Yeah, there's so many. I think for me personally, because it's very close to home, the checking of equipment before you do stuff is probably, if you're an anaesthetist, you start at the wall and you check the oxygen supply, and then you follow the pipe, and then you get to the machine, you check the machine, and then you check what goes in the machine, and then you check the pipes to the person, and then you check what's in the person. It's a whole journey, and the same goes for emergency medicine. I've got loads of examples, but things like batteries. Yeah. Okay, batteries go flat. Yeah. And a lot of medical equipment, certainly in the older stuff, actually had batteries in it, or batteries that needed charging. And I was quite diligent in my checking. I would always check the resuscitation equipment really, really well. And that involved the ECGs, the ventilators, and all of those things. But you forget that those little torches that you have to put down, something called a laryngoscope, that you put down someone's throat when you have to put a tube down to help them breathe. If those don't work, you can't see, and you can't get the tube in, and the person dies. And I've been through checking, and everything works, and one day the battery didn't work.
Oh dear.
But I checked it, and I changed the battery, and half an hour later, patient comes in, needs intubation, and I remember thinking, thank God I checked the batteries. It's something so simple, but if And we did it every day. You signed off, you had checked it. But I could have opened the drawer, closed the drawer, said I checked it and didn't.
Yeah.
But so checking is, for me.
Yeah, absolutely, 100%. Every time. We call that in the entertainment industry, when you set up your stuff or before you leave home to go set up, we call that a moron check.
It's
I don't
exactly
know if
that.
we're in the same industry. I've never heard that phrase before. Moron.
Yeah, it's for tech guys that leave
I'm not
stuff
a tech
behind.
guy, as you can tell. I'm the
Entertainment, tech, similar
I'm the
things.
talent, yes. Dr. Steve, what should patients look out for in order to know that they are in a trustworthy clinic?
Great question. There's a lot of misinformation around this, sort of floating around from time to time, and I think it depends what you're looking for. In an emergency, you often don't have a chance to decide, and you may even be taken somewhere.
Yeah.
So that's really difficult. But on the more sort of, I want to say, the cold cases or the sort of elective basis, you must do your research. You must get referrals. You must get opinions. There's more and more stuff coming from healthcare funders that says this is a good place. These guys have, in fact, I know that the funders, the medical aids, actually do this. They look at individual doctors. They look at how long those doctors' patients stay in hospital. They look at really down to the details.
Stats,
So they can tell you, and I think maybe the best, the hospital will tell you as well, but I think a recognized brand is always going to be a good thing.
Yeah.
Knowing that you've done your own research. And I must say this, a lot of people say to me, well, who's the best surgeon? Or who's the best for this? And it's a very difficult thing to know because every surgeon, every medical person, everyone I know has made a mistake before. And that in itself means that something could go wrong.
Very loaded question.
Yeah, you can also have a clash. The best surgeon might be a complete, can't say it on air,
Bum.
but yeah,
I'll say it.
Okay, so there's often that sort of rapport that needs to be established
Yes.
as well. So do your own research. You can phone your funder and find out.
Okay.
Often the funders will choose
Makes
the most
sense.
economical place. They'll choose networks of people that
Yeah.
are appropriate. So do your homework.
Can you, on the face of it, judge how safe a clinic is based off maybe the way it smells or cleanliness? I'm only asking because a lot of times when you go to, let's say, rural areas where there's just one clinic for that whole community, it's going to be hard to keep it as clean as a private one where you only see two people coming in and out. Does that have any correlation with how good that clinic can be?
Yes and no. I mean, if the place is filthy and it's not cleaned often, your risk of sepsis and infection is going to be much higher. Just as a sort of common sense observation. Often, though, the staff are very good. I mean, I remember thinking, when I haven't worked there for a long time, but I used to do a lot of my work in the state hospitals, and there were days when you had the professor, you had the registrar, the medical officer, the intern, everyone looking after one person.
Yeah.
And that person probably got the best care in the world from a quality perspective.
Yeah.
But then maybe the laundry wasn't working and the sheets were dirty. So you had this real kind of mishmash of what quality really means.
Yeah.
In Santon, quality means you sort of... I won't go down. I mean, I don't mean Santon too. I mean that Santon in itself, people have an expectation that the food is good and the laundry's done an amazing job and that there's...
everybody is friendly.
Exactly.
Yes.
So there's that view. For me, health safety and health outcomes don't depend entirely on that. It's not a hotel.
Yeah.
Those things make your stay a bit more comfortable. But what's important is the nursing. What is important is the doctoring, the equipment, that sort of thing.
Is patient feedback actually used to improve care?
Certainly in my business it is. It's used all the time. Every single complaint, observation, medical, legal, everything goes back to the doctors concerned. They're asked for their review of the case, of their themselves, their conduct, whatever it may be. All of that is farmed right back through the system to make sure that it improves.
Amazing.
Earlier on, we spoke about, people knowing what they're putting into their bodies, and you made mention about virtual care is there, do your research. In the broader speaking, not just virtual care, what role has technology or does technology play in keeping patients safe today?
So it's getting better and better and better. And I think things like, first and foremost, electronic health records. First, you can imagine in the old days there was a folder or file that was stuck in the cabinet. The doctor's busy, wrote down a few things. Next time he arrived, he can't remember what he wrote down, or what he did write wasn't actually everything that happened. So I think record keeping has improved substantially. And
Scribe MD.
Yes,
false favorite.
And that's made a huge difference to the quality of records, and it stops repeat and unnecessary testing being done, which reduces the cost. It reduces medical legal risk because all the information is documented. And of course, equipment as a general statement has got better. So there's loads and loads of, ECGs have got better, defibrillators have got better, equipment's got better. All of those things have improved. And even if you take a simple needle that you put a drip up with, an IV line, those now have got safety caps on them, and that you don't bleed on the floor. You can't prick yourself with those things. So everything's geared towards safety in this world.
Our final question, Dr. Steve. What advice do you have for nervous patients who are afraid to speak up?
Don't go!
Don't go!
Don't do it!
Move away from the lights.
Look, not many people enjoy going to the doctor, particularly in an emergency. Being prepared will help relieve the anxiety when something does go wrong. And that means there's no problem with driving around, seeing where your closest hospital is, seeing that you like that hospital, you know where everything is, where the parking is, whatever. So it's actually a good thing to do that.
Yeah.
Make sure that you know what medicines you've got. Make sure that you take your own precautions and you've got your own bits of information ready to go. And doctors are not horrible, scary, terrible people.
Or at least not all of you.
Not all of us, no.
Okay.
Well, at least not you.
Yeah, exactly.
I'm very sweet and kind. The point is, though, I think in order to, if you're nervous, you kind of need to expose yourself, read about it, educate yourself, know where you're going, and trust the system.
Absolutely. Dr. Steve, thank you so much for your time. I know I feel better, and I know where to go and what to do and how to do it. And
both of you are looking at me like I'm the biggest skeptical in the studio. No, I feel better too. I think for me, it was really just for the listener that, because I know a lot of people are very nonchalant about medication, and a lot of us just go to the internet, or we listen to a lot of word of mouth just because something worked for Gamo, and Gamo wants to shove it down Paul's throat just because it worked for her, and we sort of blindly follow the advice of people who are non-medical. And so I just wanted us to sort of just have that conversation where we're telling people that yes, we could have the same illness, but it doesn't mean the same thing is going to work in curing that illness. And I think you've communicated that.
Can I add one thing?
Yes.
I think that it used to be that you knew a doctor was a doctor because they had their certificate on the wall behind them. And I think that's changed. If you go to an emergency unit, that's not there. If you go virtual, it's not there. A lot of sort of GP rooms are not how they used to be. So it's hard to know, is this person a real doctor? Where do they qualify? How much experience there is? But you can get all that information online. You really can. And you can check it and you can verify it. If you're worried about someone, there's processes to follow to report. Bring it to attention. What I don't like is that people don't do any of that and then complain. But that's because they didn't go to the right place. They didn't get help because they went to the dermatologist when they should have gone to the physician. Find out. It's your body.
Knowledge is power,
At the end of the day, it is your body.
Yeah.
Honestly. Thank you once
Thank
again.
you, Dr. Steve.
And thank you for dressing up. Are we getting a dad joke today? No?
You look
No
fabulous.
dad joke.
Not today.
Okay. I tried. I'll try every week. Are you coming next week? I'll try again.
I'm bringing my dad jokes next week.
Excellent. You're going to run
While
them
you
down.
edit, please bring us a slice of cake. We don't do an apple a day here.
Thank you, Dr. Steve. Thank you for your time.
Great pleasure.